That's the very simple picture of ultrasound in which you obtain a picture for the uterus. And this is a longitudinal section of the uterus, of course, the sagittal view, in which you can see how I'm using the probe here. The probe is used suprapubic longitudinal, and of course there is a landmark here in any probe you are using, and that landmark is very important, and you should know that this landmark, which is used towards the head of the lady, that means that you are getting the longitudinal section of the uterus, and you should have that landmark corresponding to the landmark on the screen. There is a landmark in your screen while you are using the probe with a landmark towards the head of your patient, and so that means that you are using it in a right manner, and accordingly you should understand properly that that picture, when I'm giving you, for example, a longitudinal section of the uterus, so it goes without saying that you know that the head of the lady or of the patient is towards the left side, and her legs or the cervix is towards the right side. That's the very easy picture, and if you understand this picture properly, so if you are going to work in obstetrics or to depict a case of pregnancy, that would be understood properly. But if you are not using the probe in the right manner, for example, you're using the probe rotated, and that landmark I'm telling you about is not in the right direction, and especially if you are still a beginner, you will notice that while you are using the probe towards the head of the patient, the picture is going to the other direction, and that's very misleading and very confusing. If you're still a beginner, that would be very, very misleading in obtaining your case or in assessing your case. And of course, that corresponds to the anatomical position. This is the normal sagittal view we know by anatomy: the urinary bladder, the uterus, and the rectum. And so accordingly, you can know that these findings are very easy to see. And of course, we should remember that there is a peritoneal reflection here, the uterovesical pouch, and again there is another peritoneal reflection here, which is the Douglas pouch. And of course, Douglas pouch is free if we don't have masses or fluid, as you can see here. And some are telling me, or especially the very beginners, and how we can see the Douglas pouch when it's free. You can't see anything. Just this is the uterus, and posterior to the uterus, you cannot see anything in this pouch. So because it's a potential pouch, you should not see anything. But if you have a fluid here, of course, film of fluid can be seen at time of ovulation, and that's a normal finding. But if you find a fluid seen clearly in that Douglas pouch, of course, we have many differential diagnoses for this case, especially if there is suspicion of ectopic pregnancy, and so you should be sure if this is an internal hemorrhage. If there is a site, of course, you will find this, and I'll get you many other pictures and many other videos for different entities like this. But please remember how that very simple picture is appearing, because knowing the normal by heart would simplify how to see the other pictures or how to see the other abnormalities later.